Hi, my name is Angelina Capers. I am the CEO here at Wakeman Health and Hospitals, and I'm coming to talk to you all today about something that I'm very excited about, something that I'm sure you've heard of. It is us getting our new EHR system, which is called Epic. So we'll jump right in and go ahead and talk about it. So what is Epic? Well, it's one of the largest EHR companies in the world. It's used by over 250 hospitals nationwide, and about 190 million patients have a health record in Epic worldwide. It was founded in 1979 by a lady named Judy Faulkner, and it is currently employee-owned and developer-led. And the headquarters of Epic is in Verona, Wisconsin. So some of the important components of Epic that we're going to talk about today is the patient engagement, clinicals, specialties and ancillaries, care at a distance, resolute revenue cycle, managed care, population health, and finally interoperability. So for the patient engagement component, this is the component that's going to give patients the tools to be involved in their health by using MyChart, tablet use, or online scheduling. And for those of you who don't know, MyChart is a web-based portable offered by Epic organizations that gives patients controlled access to the same medical records that doctors use and provides convenient self-service functions that reduce costs and increase satisfaction. Patients can view their lab results, their procedure results, they can schedule appointments, and they can even send direct messages to their provider. And then as far as tablet use, patients in a hospital with a hospital stay can use a tablet to stay in touch with their care team, or review their schedule, access personalized patient education materials, and request help on the Canto app. For the clinical component, there are screens, workflows, and specialty applications that are tailored to fit. There's streamlined tasks and mobile apps for providers that help physicians strive. And then you can deliver safe and high quality care with predictive analytics and embedded decision support tools. And there's a discovery function where you can recruit study participants and conduct independent research. So now we'll move on to specialties and ancillaries. This component has curated content that is flexible and pre-built content for specialties. It is a community, you can get access to community expertise, which is specialty steering boards made up of experts in their field that contribute content and guide development to meet real-world specialty needs. There are dedicated models currently for behavioral health, ortho, long-term care, dental, rehab, obstetrics, genomics, medical oncology, home health and hospice, wound care, ophthalmology, infertility, cardiology, nephrology, gastroenterology, and transplants. So as you can see, they have really tailored some of these specialty services so that everybody that works in that field can see exactly what they need to see. The next component is care at a distance. On this section, there are specialist referral services which can provide remote and rural primary care and telehealth services. And these include dermatology, telepsych, telestroke, teleradiology, and teleemergency. There is also remote patient monitoring, which includes remote ICU monitoring, case management and discharge planning, and remote intensivist coverage. The next thing is peer-to-peer consultation, which allows for second opinion services for providers. And there's also ongoing patient care, which allows for video visits, school nurse consults, prison video visits, and even post-surgical follow-ups. The next section is resolute revenue cycle. In this section, you can speed up payments and free up staff time with paperless billing, online pay, payment plans, and estimates. You can also consolidate all of patient outstanding balances by combining their inpatient and clinic bills into a single statement to make paying bills simple and easy to do. There's automated coding and charge dropping that keeps you in compliance. And also integrated clinical and financial decision support, which reduces administrative overhead, avoid missing charges, and shorten accounts receivable days. The next component we'll discuss is managed care. In this component, Epic can be the system of reference for member demographics, coverages, and benefits information, which determines their enrollment and eligibility. The customer relationship management provides outstanding service and management correspondence with members, vendors, and employers in one integrated database. The portals for providers and member services provide full picture of health and membership information for members and secure web portal for providers to interact with, view managed care information. Utilization management takes advantage of medical necessity criteria and network-based provider recommendations at the point of service so providers can make the best financially responsible decision for the care of the patient. The claims, education, and premium billing automates your claims processing and premium billing invoicing with a payment system that scales for large, excuse me, sorry about that, large and complex member populations. And the next step is population health. In this section, we can bring in data from any vendor source, communicate with other EHRs, implement and support program with business intelligence and scientists, and get a deeper understanding of costs to help us manage our resources. And then the last section, healthcare reform and regulatory compliance. This uses ICD-10 codes, PQRS, and ACOs, and other regulatory requirements to help our facility stay in compliance so that we don't have any issues with the federal government. And now we will watch a quick video on the so you can see kind of this Epic program in process. You hit the record.
Straight. You may see Dr. Jameson as soon as you update your medical history record. Whatever. Check, 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 check. I just need to see a darn doctor. Looks like we are going to have to administer a special dosage of antibiotics. I just need anything to help me feel better. Nothing seems to work. Okay, looks to me that your medical history is up to date. I am so sorry to tell you this, Mr. Bradley, but you apparently had a strong allergic reaction to penicillin. Uh-oh, looks like you have an allergy to penicillin. Seems like this was discovered by a private doctor's office about a year ago. Wow, that was amazing.
Tell me about it. That is only the beginning. Let me show you how this technology will be the future. Epic Care combines chart review, order management, and documentation in a fast system that can learn your preferences while you work. It organizes patient information, suggests actions, and guides coordinated care across physical care settings.
Who would the trainers be?
Training consists of the training project manager, who oversees the Epic trainers to ensure quality of Epic training. Next, you have principal trainers from your facility that are certified in specific Epic applications. These trainers will complete training at the Epic headquarters. Last, you have your credentialed trainers. These trainers conduct the trying session using the materials developed by the principal trainers.
So you are telling me no more cluttered files?
No, not only does Epic allow access to medical records, it also gives healthcare technicians patient lists, lab results, clinical image capture, chart review, and many more.
Wow, less wait time, more organization, less mistakes. What more could you possibly ask for?
Since you asked, let's go see the physicians. As you can see, the principal trainer is teaching our physicians more about the technology integrated in this system.
The cable offers extra Epic chargers, messaging integrated in my functions. Physicians can use the dashboard style front end to check schedules, respond to messages, take notes, e-prescribing, and review lab results from anywhere.
How are you all adapting to the Epic system?
Personally, I love it. It is so much easier to be two places at one time.
I agree. What? How is that possible?
How ironic. I can demonstrate now. You see, I am signing orders using CPOE. Orders will immediately go to the appropriate department.
Would you look at that? I just approved discharge of a patient.
And I just used ePrescribe to send a patient's prescription to the pharmacy of their choice.
You've got a deal. Thank you, Epic.
You see, everyone wins.
See from that video. So, as you can see from this video, this facility had a very successful implementation of Epic, and we're just hoping that we'll have the same here at our facility.